I'm sharing my screen. All right, let's talk about it. Oh, page 1. We're going to present. Hello, welcome to Practicum 6531, primary care of, wrong button, of adults. They didn't do it. So I am your instructor, not your preceptor, instructor, Dr. Sheila Fales. I have been a family nurse practitioner for over 20 years. I have been with Walden since 2018. So I calculated that to be about 6 years. My love is primary care, adults, geriatrics, and diabetes. I do have an established clinic in Alabama. I do psychiatric just because it's a need. I have virtual assistants. They can do any and everything for $6 an hour. I match nurse practitioners with physicians. I do medical weight loss and non-medical weight loss. I teach credentialing and coding and billing. I teach nurses how to make money from home with doing phone calls, chronic care management. I teach nurses how to start their own medical nursing businesses. So know your chain of command, know your program directors, clinical supervisors. If you have a problem with me, know your chain of command of how to proceed. So always review your syllabus and your course calendar. This is an 11-week course. So plan ahead. That helps. Um, keep extra computers. I have, even me, I have 2 or 3 computers just in case something happens with one. Always follow the university code of conduct, being honest, don't cheat, don't lie, don't copy. Watch what you post on social media. Why would you bad mouth a Walden University? You're going to be a Walden University graduate, so watch what you say. Nothing is private on the internet. We see it all. The best method to contact me is through the Walden email. You can schedule at any time to meet with me using the Zoom room, and always use your Walden email. I used to say people could text me because it's still written correspondence, but to be uh, legal, let's keep it to the Walden email. I usually post the announcements at the beginning of the week. I always check that verification form. Um, Once you review this video and review the slides by Dr. Sharp, post your verification form in the class cafe with your introductions.
Hi, Dr. Phelps. I have a question.
Okay, great.
How you doing tonight?
Oh, I'm great, thank you.
That's good. My name is Angie Ely, and a couple things. I tried to email you, and it happened with the other instructor I have as well because I'm taking 2 classes now, and neither one of your names populated in the email, so I couldn't get through. Um, I don't know what that was about. And also the form that you just spoke about. I tried to hit the button to get that form. How can I find that so I can get it submitted? The verification form.
Did it not work in the
It
announcements?
did not work for me in the announcements, and the email didn't work either. I ran into a couple problems right off the bat.
Okay, so let's look at it. What I was going to say. So the email is going to be that Sheila.Fales at mail.waldenu.edu. So that should work, that email. And so I'll look at that link in the announcements and see and make sure that it
Thank you.
works. Yep. You're welcome. Verification form. Late assignments will receive a grade reduction even with approval. Like I said, you all should be planning ahead. I've used this same slide since 2018. Oh, I'm lying, but a long time. So we still plan ahead because of COVID. Grading, I will grade your assignments within 10 days of the due date. I will do that. Look for the feedback in the rubric. You need a C to pass this course. This is independent of your didactic course. So you do need a C to pass this course. You're doing your introductions in the class cafe. Clinicals should be fun. It should be an opportunity to learn hands-on, applying what you have learned in the classroom. You're going to submit your calendar in the Canvas. You don't have to email it to me. You're submitting your practical site information. I'm verifying you all sites. And I need to add investigator to my biography because I do a little investigation on all of you all. Make sure if you're in clinicals this week, that you're logging in your time. What do you need for clinicals? Professional attire. Depending on where you are, will depend on your attire. You know, sometimes certain clinics wear scrubs. So you should do what's according to where you are. A name tag, most of your sites should use a stethoscope. I'm saying that because like dermatology, they don't use stethoscopes. So, but you should be in a site where you will need a stethoscope, have your own gloves, mask if needed, and always have references, resources, books, and you can use your cell phone if needed to look up things. Your requirements, 160 hours and 120 patients. Don't quote me about this. This changes a lot about the ages that you can see. I know that your SOAP note should be on somebody age 18 and older. You can count 8 hours of shadowing, only 8 hours, because after day one, you should be seeing patients and being interactive with the patients. So what's the first day should look like? You're going to introduce yourself to the staff, to be confident, ready to work, find out where the computers are, break room, charts. Will you have access to their electronic medical record? Take a break according to how they take a break. Find out will you have access to electronic medical record, and find out your population so you can plan ahead. Is this a lot of cough, cold, sinus? Is this a lot of pap smears? Is this a lot of weight loss? So you can plan ahead and know what to do and plan for your SOAP notes that you have to do. Of course, you're going to shadow first. You're going to progress as the clinicals progress. So usually you'll start out just watching. Then they may have you go in, ask a few questions. They may have you go in with them for a week or two and see how they do the process. You may eventually advance to doing the physical exam where your preceptor is watching you, and then you're able to do the physical exam without the preceptor in the room and you just report off. So that's our goal, to progress to that level. You're not independent at the beginning. Note I said that. Like I said, it's good to start off with cold, sinus, respiratory. That's pretty easy. Blood pressure, diabetes, get into those medicines can be more complicated. Of course, musculoskeletal and neuro is a pretty comprehensive physical exam. With COVID, you're still, now we got RSV, limiting your exposure. We're looking into those ears, Make sure you got a mask on and not talking and spreading germs with the patient. We do focused examinations. You're going to ask questions pertinent to the chief complaint. We always recommend that you listen at the heart and the lungs. Examples of focused examinations: sinus. Are they short of breath? Are they having chest pain? Is it low back pain? Is it a headache? So think about which systems you would assess with a complaint of headache. Grand rounds should be fun. It's nothing for you to prepare for. It's just interactive where they present a case and they talk about a case in real life situations. You should not complete your hours before week 8. Week 8 used to be 6, but do not complete your hours before week 8, and preferably by week 10. As far as I know, it's no more telehealth to count towards your hour requirements. You can do it if your preceptor is doing it, but as far as meeting your hour requirements, those hours should not count, or those patients should not count towards your requirements. You need to log your patients and your hours into Metatrick at least every 48 hours. That's just because you do not want to get behind. In my private practice, I'm not gonna tell you all. I'm 2,000 charts behind. And I'll show you if you want me to show you. I have 2,000 open charts that I'm trying to get done before the end of the year. So that calculates to 100 charts I need to chart on per day. Don't do that. Please don't. And plus, that's legal because they can request records at any time. So that just gets you in the habit of keeping your charts up to date. This is an example of a time log. What goes into Metatrack is a brief synopsis. It is not a soap note. This is in your Metatrack of what should go into your patient logs. Your preceptors need to sign off on your hours in Metatrack. I personally do not. We want them to do it, but you're glad that they are letting you be their student. So I don't really, as you know, I'm behind the charts. We don't like charting. So as long as they do it within like 2 weeks, it's fine. I would not sign off on your hours until your preceptor does. Sometimes they do not receive a Metatrack login for a few weeks. Preferably, we want them to complete the midterm evaluation before our midterm conference call. Soap notes, you're going to submit 2 copies at the same time. One to be graded and one that's going to be initialed and signed by your preceptor. The one that's graded is the Word document. You have 3. Weeks 3, 6, and 9. You must achieve a 70% on at least 2. No more redos. This is important as nurse practitioners. SOAP notes. SOAP stands for subjective, objective, assessment, and plan. Subjective is what they tell you. Objective is what you observe. Assessment are like the diagnoses. Plan is what you're going to do. And you're going to add a reflection note. History includes all of these things: history of present illness, past medical history, family history, social history, and review of systems. HPI should flow like if you're doing a report off. Hey, this is a 37-year-old Black female, presents with chest pain times 3 days. This makes it better. This makes it worse. HPI is important. Differential diagnoses have at least 3, include ICD-10 codes. Always consider labs and tests. Have at least 3 references. I'm just gonna see how many, what all it is that you all do. I'm taking notes. Find out a way. This goes with that HPI. How long has it been going on? Where is it? What makes it better? What makes it worse? Does it radiate? Is it moderate, mild, severe? All of those things are important for your HPI. I will have a minimum of 3 contacts with your preceptor. There is nothing for you to do this week. I will send out an email. Your midterm will be virtual on camera. Let's talk about it. I'll send you a link around week 4 that you can start scheduling. It does need to be virtual. On camera, if my little 80-year-old patients know how to get on camera, surely you and your preceptor can. You do not have to be present. Oh, this is different. It says with only 1 preceptor, but if you have more than 1 official preceptor, I need to meet with both of you all. Your preceptors that are approved through the school, I need both of them. So that's cute. My virtual assistant did that. Any questions?
Dr. Fields, I had a question. I was just wondering, I think I got a little turned around about the 160 hours versus the 120 hours. So the 120, is that patient contact? And can we get the points if we either observe, assess, or participate, or does it have to land in one area or the next?
Okay, so like I said, I've been with them since 2018. I always get the 160 and 120 messed up. So it is, let's see, which one? It's 160 hours, right? And the 120 patients. So that's a good question. So even when you're going in with your preceptor and you don't do a thing, you count those hours and you count those patients. So just say, for instance, like you said, you're going in with the preceptor, you still can count those patients and those hours.
Okay, even if
But it
we
is 160
Mhm.
hours and 120 patients, right? Yep.
Yep.
I can't never remember if it's the opposite.
And I got a little confused on that too. So even if we are observing only, that would still count as patient time?
That's right.
Okay, even if we
Even
don't.
though literally 8 hours is shadowing, you got some preceptors know their patients and know they
Correct.
got patients that they don't want to talk to a student. That
Right.
type of deal. Or you got a patient, or if you busy that day, and hey, so you still can count if you don't do a thing. You still count those hours and that patient. That's right.
Okay, thank you.
Uh-huh.
Dr. Fowles?
Uh-huh.
Hi, so I had a quick question about the week 1 assignment 3. Um because of the holiday weekend, I was not able to log any hours this week. My hours will be starting next week, but the assignment is due on a Sunday.
So yeah, that's fine.
That's
If
okay.
if you're not in clinic, it won't count against you.
Okay.
So like you say with Meditrack, if you can only count, if you haven't seen anybody, then there's nothing for you to log. So that's fine.
So I don't have to do anything for the assignment on
But
Canvas.
that's right.
Okay. I also had like a personal question in terms of my specific site. I don't know if that's the right place to do it here or
It's up to you. You can use that link to schedule.
yes, I appreciate it. I scheduled a link, but you weren't available until Friday, and I just wanted to let them know. My preceptor told me that she was going to be away for 3 weeks. Um, so I
So that means you have to plan ahead.
Yes, so I'm more
Yeah.
than happy. I said that I would come in 3 days a week, on the days that I'm not working, but I want it to be known so that if you don't see anything in Medicare,
Oh, okay. Good point. Good point. Good point. So yeah, like I said, if you're not there, that's fine. But like you said, for cases like that, just plan ahead for yeah,
yeah. So
yeah.
that's okay if I have 3 weeks of inputting technically nothing, but I have all my hours.
That's right. That's fine.
Okay,
Yeah.
and also the assignments to soap notes, if it I think it
So
was
just
about
plan ahead. That
okay.
way, like you said, if you know you got something week 3,
Mm-hmm.
if you got something week 6, and you might have to do it earlier for your
Okay.
week 6 to plan.
Yeah,
Yeah, plan ahead. That's right.
that is fine. Okay, beautiful. Thank you.
I think I know I'm beautiful. Thank you.
You're working it. You're working it, Doc. You are. Thank you.
Oh my God. I'm too silly. All right. Well, look forward to working with all of you. I can't wait to, because I do this, I've been doing this a while, and it's like, I don't know if people don't watch the video, but if you follow my directions, you will be good. I'm just going to see how many do what I mentioned in this presentation. I can't wait to see it.
Thank
All
you
right.
so
You
much.
all have a good
Dr.
night.
Bell, it's just that verification form.
Uh-huh.
I don't want to be late on that
Oh,
one. Is
yeah,
that
let's
due?
look at it. Oh, yeah,
Yeah,
let's
yeah.
look at it. Where was I
I
going to go
appreciate
look?
you. Okay. I'll
Let me
open
see
it
where I
anyway.
cannot look. Okay, there goes Walden. And let me go to a course. Yep, thank you for reminding me.
Thank
Let's
you. I
see.
appreciate
Because
you.
like you said, I've been using the same link
Mhm.
forever. So let's see if it works. Oh, I need to check message. Nobody else has said it hasn't. That's why I
Maybe I'm
usually
doing something
look at that.
wrong.
Huh?
Maybe I'm doing something wrong.
Yeah, that's why I kind of look at if like nobody else has said it.
I know I did have the same problem also.
Oh, so announcements and so I might need to post a new link. Welcome students and
Okay, I'm right there with you.
um I don't even see it. Oh, it's supposed to be those links to external site.
It was under that one, and it actually said verification of Zoom meeting. It says sign. It says
Oh,
right below that. It says sign verification form that you have reviewed the PowerPoint slides. It was right under where you.
uh-huh.
Uh-huh. Yeah, it was right under there. Can your screen go down a little more? It's right below that.
Okay, let's see. Let's see. It's all the way at the bottom. It's not even popping up on mine.
Yeah, mine is here. And when I push it, verification of the Zoom meeting, sign the verification.
Okay, so I'm gonna do a new announcement and post the verification link. Because you're right. You got a good point. Because it's even a whole new computer.
It
So it
says
might not be in
this
here.
site can't be reached every time I push it.
Oh, okay. So I'll post. Yeah, this is a new computer, so verificate. It might not even be on this verification. I'll post another link and let me know if it works. Okay, thank you. Let me see if anybody has done any introductions. I'm just finna see what y'all been doing. I can't wait to see this.
Dr. Phil, for that introduction, can you put your email in there too?
It's under the meet the instructor.
Oh, thank you. Okay,
So
I'll go.
so y'all see this, right? I don't have any introductions. Yeah, y'all don't want to introduce yourselves.
I thought I
I
put.
thought I
Okay.
put mine in there.
This just one. So I'm looking and attention.
I
Which a
thought
lot of people don't realize they need to do it because they do it in the other class.
I think
A
I
lot
did
of
it in there. I think I put one.
Yeah. I'm just so yeah, I'll make sure you got the right link for the very like you said, I've been using that same link, so it might not even be on this computer. Discussions. Somebody introduce themselves. November 26th. No comment. All right. You all have a good night.
You too.
Can't wait to read your introductions and get to know all of you.
Have a good one.
Okay, you too.
Have a
Good
good night.
night. And